Hi, I'm Dr. David Cruz of WebExercises.com. What we're going to bring to you today is how to treat a low back without actually treating the low back for some chronic pain patients. Now with back pain patients, what we find is that a lot of times they don't know how to properly move. So therefore they overuse their back. So if they have a problem with degeneration or a discogenic problem, they continually overuse these areas contributing to their pain. And one of the biggest reasons is that they lose the ability to properly use our gluteal muscles and our hips. Now Lisa here is going to turn and face away, and what I want to describe is that when we stand, we should all have a curve in our back. We refer to this as a lordosis. This is a normal position. Somebody with chronic back pain, a lot of times we'll find, is when they sit, I will hold this here and I'm going to have Lisa sit, they end up rounding their low back and sit down, and they lose that position. So we no longer have much space for that proper curve. So I can have Lisa stand up again. What we want to show is how to maintain that proper position, sparing the back. So I'm going to hold this once again on the back. She's going to now sit down. She hinges her hips, sits down, and she maintains that curve the entire time. If she stands up, she maintains that curve again the entire time. Now what this does is it minimizes the stress on the back and puts the workload onto the hips. Now so often people lose the ability to use the hip and gluteal muscles in what a term is called gluteal amnesia. Now this term was coined by Dr. Stuart McGill, who's one of the leading professionals on spinal biomechanics. What I want to show you is how to do two simple things to help minimize the stress on the back by working the hips. So I'm going to have Lisa have a seat. The first is a stretch for the glutes. She starts by sitting up nice and tall. She's going to cross, putting one ankle on the opposite knee. From here, she's going to interlock her fingers around the knee, and she's going to pull in a diagonal to this opposite shoulder. She pulls until she feels a stretch in the gluteal region. She holds that for 30 seconds. We maintain a good spine position. We do not round. She does not rotate her shoulder forward. Everything is done at the hip. Spine is spared. When we switch, knee opposite, ankle opposite knee, and we're going to pull opposite shoulder. And again, neutral spine, no rotation, no rounding. We also want to make sure that ankle stays on that knee and does not slide down. So you can relax. Now that will start allowing us to bend and start hinging a little more properly, but now we need something for strength, because as we sit, we need to contract those gluteal muscles to slowly lower us down. So I'm going to have Lisa stretch out on the table. She's going to lie down on her back and bend her knees. Now this is called a hip bridge. Very common, but let's talk about how we want the mechanics done. A lot of times I like to have patients palm up because that just drops the shoulder blades back. It also minimizes any sort of tendency for them to want to use their fingers or hands to help them. We're going to make sure we have good hip, knee, ankle, foot alignment. The first thing she does is a little tightening of the abdominals. Not to the point she rounds her back, but just a little tension in the abdominals. Second is a little tension in the gluteal muscles. Tightening the glutes, we're going to emphasize glute action, minimizing hamstring. Now this exercise will also incorporate hamstrings, but we really want to try and address the glutes, so that's why I wanted to squeeze the glutes as well as a little tension in the abdominals. We call it an abdominal brace. From here, she's going to lift up. Good. Pause. She does not hyperextend. She does not come any higher than a straight line movement. Down, touching and back up without losing the engagement of her abdominal core muscles. Down and back up again. Good. Relax. Now what we've showed you here is how to stretch the glutes, how to start strengthening these, and now we can start properly moving and bending, sparing the back. We lose function in the glutes, we overuse our back, leading to chronic repetitive injury throughout the day. If you liked what you see here, you can find this and much more at WebExercises.com. Sign up for our free basic account and you'll be able to create exercise programs and email them for free to your patients and clients. Stay tuned for more.